If you've spent much time surfing the web, chances are you've happened upon or been directed toward one of these kinds of sites. These almost always interesting and often provocative videos are usually comprised of some amazing set of macro statistics that cover topics as diverse as global demographics, linguistics of all things, high-end human resource issues, and so forth. And many of them presumably imply some mounting problems found in American leadership in some unclear way. But other, more micro-analytic webcasts begin with a more ground-up analysis of the internet itself. And together, or taken separately or together, they leave little doubt on America's standing as still the world leader in all things internet, particularly the frontiers of cyberspace that is clearly at this multimedia, broadband, mobile nexus. And one of the more dynamic, certainly one of the more important emergent areas in broadband applications is itself found in mobile healthcare, or mHealth for short. For coupled with the larger, albeit still a bit nascent, revolutions occurring in U.S. healthcare, mHealth may well circumscribe the most profound set of opportunities that any of us will ever see. Well, about now you may be having thoughts along the same lines as our friend here, and asking or thinking to yourself, well, I've heard things like this before, but what does it really mean to me, or my job, my career, my family, my life? And by way of putting that question to rest, I'd like to return one more time to the big numbers and then begin to deconstruct those into the more relevant, personal, real point of this presentation. So the big numbers would have us focus in on the absurd magnitude of American healthcare spending, nearly $3 trillion, over a sixth of our entire economy, a totally unsustainable and arguably unnecessary level given the per capita spending of other developed countries, less than half of that. And it's not even that evenly distributed here. The $8,000 to $9,000 turns out to be a lot more if you're one of the chronically afflicted individuals. In fact, some 75–80% of all costs are there, and they themselves can be subdivided into some interesting segments and subsegments. The elderly, a prime example, or seniors, typically 80% have at least one of these chronic diseases, 20% have 5 or more, and we all know the demographic status of America is taking us in a direction where that problem, or that disproportionate amount of spending, is about to get a lot worse. So when we think about that, and we look at the exposure that has to individuals, and we further take into account the fact that only about a sixth of us have any long-term care, and over 60% of those of us that do probably isn't enough, you begin to think, well, what are we going to do about that? How do we deal with that issue? Well, of course, there are lots of different kinds of health and healthcare cost issues, and the various treatments, tonics, reimbursement systems, and so forth that attend them all seem to grow more inescapably complex all the time. But they do all seem to have at least one simple common denominator. And that, of course, are the patients and their extended caregiving families. Medical miracles and massive affordable care reform movements notwithstanding, there's a body of evidence that some of the most effective ways to limit cost and improve wellness do lie in better patient engagement within individual care circles, as they're sometimes called. Kind of like a winning football team, these expanding teams are typically quarterbacked by a close friend or family member who in turn usually is the coordinator of an amazingly efficient set of efforts of those expanding care circles themselves. Stretching the football team metaphor a little further, the new head coach in these burgeoning medical home care centers, call them what you will, is the primary care physician. Like the good coach, the family doctor not only guides the medical and wellness strategies,
She also serves as the gateway to most all other professional care, drugs, therapies, and so forth. But in a weird kind of way, up to now, the primary care physician's manifold duties, their relationships, regulations, revenue requirements, practice management systems, and all manner of other health information technology seem to be conspiring in a way that partially estranges the key player, the doctor that is, from the less acute, the less reimbursable, the day-to-day dramas that actually comprise individuals' health and wellness realities. That said, as Bob Dylan said in the old song, the times they are changing. Digital monitoring, broadband mobile communications capabilities are now making the doctor's everyday connection with large populations of patients a distinct possibility. We'll return to this professional population management side of the equation in a moment. But first, let's take a closer look at just how mobile broadband devices and applications are actually animating a new Back to the Future era in patient engagement and the powerfully effective dynamics of care circles themselves.
We'll soon shake your windows and rattle your walls, for the times they are a-changing.
Once again, channeling Dylan, a quick review of the main points so far. We begin with how quickly and pervasively times are changing. Some of these changes are irreversible, others are just unsustainable. The case in point here is American healthcare costs. A healthcare reform regime that aspires only to spread costs more widely doesn't really get at the problem. But help is on the way. Paraphrasing Henry Kissinger this time, peace is at hand. Or more precisely, a piece of the solution is already in our hands. Because it was earlier noted how rapidly Americans have taken to broadband applications and the homegrown technologies that enable them. And now we can begin to connect some dots, or if you like, to complete the circle of a far more cost-effective healthcare future. Because as pointed out earlier, the vast majority of healthcare costs are driven by chronic diseases that tend to escalate with age and peak at end of life. And while none of us can evade the Grim Reaper indefinitely, most of us do have more power than we may think to manage our own and the folks that we care about's costs in the interim. And most of those ways involve meaningful behavior change, or as it's often referred to, patient engagement. And one of the more obvious, most obvious I guess, though not always the easiest way to avoid the various costs that attend a chronic disease is just not to get them. The other equally obvious way to live a better, less costly life with the challenge that always attend chronic heart disease, asthma, diabetes, and so forth is to simply manage them better. And here's where there's a bit of good news. Chronic disease management and wellness are relatively cheap, if not easier. Both rely upon sharply expanded engagement of an entire community, the overlapping ecosystems of patients, friends, families, nurses, pharmacists, primary care physicians, everybody. More precisely, the prescription for 21st century healthcare may, I would submit, must be more of the former. That is, more patient and community engagement and more effective leverage of the professionals proportionate to their relative costs. That is, what we need to do is displace paid healthcare where we can with friends, families, and individual initiatives. We need to replace where we can doctors with nurse practitioners, specialists with primary care physicians, all of these operating jointly and more effectively within a medical home environment. Turning now for a quick look at the enabling mobile broadband technologies themselves, or at least a glimpse of the various end-user interface appearances. It might be good to first note that the underlying opportunities that we've outlined already are apparent enough to enough engineers and entrepreneurs that they're already creating a virtual avalanche of applications and associated health information infrastructure. That said, one of the more exciting collections of patient engagement tools are being assembled by a small startup company in the Research Triangle Park area of North Carolina called Family Health Network. Their Connected for Life platform comprises a benevolent, non-invasive Trojan horse of sorts. Now, that may sound like something of a conflict in terms, but it's not. At one level, Connected for Life, or CFL, is a versatile but intuitively simple multimedia, multimode messaging system that facilitates a wide range of connections among and between a patient or a caree and his or her various caregivers. At its most basic and recurring level, it could work something like this. Connected for Life, or CFL, periodically reaches out to a designated caree with a simple check-in kind of question. Aunt Betty from there can easily reply with, "I'm fine, but busy," or something quite different. But in this way, a multi-point dialogue begins. Its foundation forms among all the often most effective and always least expensive folks that can in fact help intervene, encourage, or otherwise influence outcomes and stay in regular touch with Betty and each other. So behind CFL's basic check-in app is a powerful inference and question engine that stays at the ready to expand this dialogue in any number of directions at just the right opportunity and in just the right context. For example, even without prompts from her Care Circle teammates, Betty might be willing to respond to CFL's automatic health journaling facility. The answer that she may give to this periodic set of questions or occasional health risk assessment, or HRA in the alphabet soup of healthcare today, collectively build another ODL, or Observations of Daily Life profile. These ODLs then, in combination with various electronic interfaces to various monitoring systems, can add assurances of instrumental ADLs, or activities of daily life. That is, our meals, medications, hygiene, proper safety measures, and so forth. That is, all the things that allow everyone to contribute and have visibility into Aunt Betty's overall well-being. Lest we not forget Betty's own role, most all of us respond similarly to similar risks, rewards, and incentives. Who's not interested in their own well-being? And in this example, Betty's natural incentives are augmented by her own improved visibility into her own well-being. Access to the reports of her ADLs and ODLs and HRA surveys. She also can check into her own medications, certain biometrically collected vital statistics, and so forth. We could go on and on for another hour or so with all the various health and wellness enabling tools and techniques contained with just Connected for Life. But first and foremost, CFL is nothing more nor less than a very powerful information sharing tool. It's a mechanism that not only facilitates this multimedia, multimode kinds of communications within the care circle, but it actually helps bring it about in the first place. It empowers and engages the patient in the creation and the ongoing control of her care circle, while inducing the circle at large to contribute regularly to their common cause. That is, keeping Betty healthy, happy, and at home. The same user interface that we've demonstrated so far would, of course, or will, work equally well, if not better, on a tablet device. In fact, tablet-based implementation could open additional avenues of both user utility as well as cross-leveraged business synergies of various kinds. The reciprocal value of health and wellness with, say, entertainment, security, energy management, and other digital apps are more or less obvious. So let's instead now close this program by turning our attention to the other, arguably more monetizable end of the value chain. So again, up to now we've focused upon patient players and their quarterback, as well as other non-professional carer teammates. But what about the other end of the health ecosystems, the primary care physician head coach and the health system general manager, as well as the labyrinth of payer people and their systems that are engaged in various reimbursement activities that fuel the whole process? And there, until recently, health information has been stubbornly paper-based. But making a long story a little shorter there, the billions of dollars of recent investments in meaningful use of electronic health records, health information exchanges, and other health information technology is now at last moving the supply side of the equation out of those dark ages. And while doctors and nurses and everyone else on this side of the world are adopting various mobile apps themselves, the majority of professional information processing is still appropriately residing on the desktop. Ergo, platforms like Connected for Life will see a large portion of the big and little data generated downstream harvested on the desktop. So once again, we could spend the rest of the day poking around Family Health's Connected for Life backend systems. So let's just take a quick peek and defer the huge potential late in all its details to another time, place. So it stands to reason that just as the patient side of the team is patient-centric, the provider side rotates around the primary care physician's needs. So in this example, we focus on a hypothetical Dr. Henry Jones, call him Aunt Betty's doctor, and he goes to his dashboard, perhaps, as a place to start, and he can kind of look at his own little big data. He could see his patients in aggregate and their various behaviors. He could look at insurance trends and tendencies, payment systems, and so forth, moving from right to left in this case. He can also, and this is where the power of Connected for Life begins to manifest, he can control the kinds of surveys that are pushed out to his patients. He can look at them in different ways. You can prescribe different kinds of programs for different kinds of people that are different kinds of protocols, or he could go all the way to a more granular level and begin to actually look at users individually, say Betty, for example. So he could take a look at any amount of different data specific to Betty from her vitals, blood pressure, we'll say, or most anything else. So again, we could spend quite a bit of time looking at all the different possibilities. The primary care physician or the caseworker or the insurance adjuster, perhaps in some cases, could even reach out to the care circle itself, that are the people that are caring for Betty, and prompt them to prompt Betty to fill out a form, to take a survey, to just get back on her meds appropriately. So once again, the power of this system is really in the population management in aggregate as well as individual. Physicians and health systems have a new level of visibility into the patient and the kinds of interactions that they're having with everyone else that fills in those gaps between the actual contacts, the actual instances of care delivery itself. So some might suggest that perhaps this is just another EHR itself, or another personal health information system, and I guess there certainly would be some overlap to a system like Epic's MyChart as an example, but it's just overlap. The kinds of things that Connected for Life does, the kind of interactions it's having within the care circle, really are quite apart, or extension downward from the much more arterial kind of huge big data flows that go on totally outside of Connected for Life, but in systems like Epic. So that can be viewed as much more complementary than conflicting, and perhaps there's huge opportunity for the two systems to integrate at just that level. So in closing, as we think our way through what we're going to do, how we're going to handle these crushing costs of healthcare in America, we come full circle, or perhaps I should say full circles. That is, it's a bigger problem than any one entity, any individual, even a community acting only on its own initiative can solve. As companies like Family Health Network, through their Connected for Life initiative, think about it, they think in terms of care in multi-dimensions. Care as in healthcare, of service, of products, but also care in the old sense. In many ways, this is a back to the future scenario. It used to be that we cared for each other better. We did that because we lived in closer communities, tighter family groups. But now, through mobile broadband communications, we can put the patient back in the center, an expanding community of interest comprising doctors and specialists at the top, families, community groups, all sorts of people in other capacities, all working together to keep Aunt Betty and everyone else home and happy longer.